1. Which of the following best describes the primary role of the medical device reprocessing technician as outlined by MDRAO standards? A. B. To clean, disinfect, sterilize, and maintain reusable medical devices safely. C. To monitor patient vital signs during surgical procedures. D. To assist surgeons in the operating room during invasive surgeries. 2. According to MDRAO guidelines, which step is performed first when reprocessing a contaminated instrument? A. Sterilization. B. Cleaning and decontamination. C. Wrapping and packaging. D. Storage in a clean area. 3. What is the main purpose of performing a leak test on a flexible endoscope before cleaning? A. To confirm the scope's optical clarity. B. To detect internal damage or holes that could allow fluid invasion. C. To verify that the scope is adequately disinfected. D. To check the integrity of its light source. 4. Which type of indicator provides evidence that an item has been exposed to a sterilization process but does not confirm sterility? A. Biological indicator. B. Process challenge device. C. Chemical indicator. D. Mechanical indicator. 5. The Spalding classification system used in reprocessing medical devices categorizes instruments based on A. Manufacturer warranty conditions. B. The level of patient contact and infection risk. C. The size and complexity of the instrument. D. The sterilizer cycle time required. 6. According to MDRAO, what is the appropriate temperature range for storing sterile packages? A. 10 to 15 degrees Celsius with 40% relative humidity. B. 18 to 23 degrees Celsius with 30 to 60% relative humidity. C. 25 to 30 degrees Celsius with 80% relative humidity. D. Below 10 degrees Celsius, regardless of humidity. 7. Which of the following is an essential step when preparing instruments for sterilization in a steam autoclave? A. Lubricating hinges with oil-based substances. B. Placing instruments tightly together to conserve space. C. Ensuring instruments are thoroughly dried and opened. D. Wrapping instruments with non-permeable plastic. 8. What is the main reason enzymatic detergents are preferred during manual cleaning of surgical instruments? A. They are less expensive than other cleaning agents. B. They are safe for all instruments regardless of material. C. They break down organic materials such as blood and tissue. D. Sterilize the instrument during the wash cycle. 9. According to MDRAO standards, why must personal protective equipment, PPE, always be worn in the decontamination area? A. To comply with environmental cleaning protocols. B. To protect staff from exposure to bloodborne pathogens and chemicals. C. To prevent contamination of clean packaging materials. D. To meet general hospital dress code requirements. 10. When assembling instrument sets, how should heavy items be placed within the tray? A. On top of delicate instruments. B. At the bottom of the set to prevent damage. C. At the sides of the container. D. Arranged randomly to allow airflow. 11. Which of the following statements about biological indicators is correct according to MDRAO standards? They detect the presence of viable microorganisms after sterilization. B. They verify if packaging integrity is maintained during storage. C. They measure temperature and pressure during sterilization. A. Indicate when an instrument tray is fully dry. 12. Which type of sterilization method is most appropriate for heat and moisture-sensitive medical devices? A. Steam under pressure. B. Ethylene oxide gas. C. Dry heat oven. D. High-level disinsection. 13. What is the purpose of a Bowie-Dick test in steam sterilization? A. To determine the correct exposure time. B. To confirm the sterilizer reaches the desired temperature. C. To check for air removal and steam penetration in pre-vacuum sterilizers. D. To evaluate if the water supply is properly filtered. 14. According to MDRAO recommendations, how often should mechanical monitoring records, e.g. temperature pressure charts, be reviewed? At the end of each work week. B. Only when sterilization failures occur. C. After every sterilization cycle. D. Once per month during audits. 15. Which of the following is a critical factor that can compromise the sterility of packaged instruments? A. Double wrapping with approved materials. B. Storing items in a clean, dust-free cabinet. C. Handling packs with wet or damp hands. D. Using indicators inside the package. 16. Which cleaning method is most suitable for instruments with complex lumens? A. Manual brushing with plain water. B. Ultrasonic cleaning with cavitation action. C. Wiping with alcohol pads. D. Dry heat cabinet cleaning. 17. According to MDRAO, how often should routine biological testing be conducted on steam sterilizers? A. Monthly. B. Weekly or daily if used for implantable devices. C. Every load. Once every 6 months. 18. What is the recommended practice when an instrument is discovered to be damaged during inspection? A. Sterilize it anyway to ensure no contamination remains. B. Place it back into service if it appears functional. C. Remove it from circulation and report for repair or disposal. D. Immerse it in enzymatic solution overnight. 19. Which factor can reduce the effectiveness of a high-level disinfectant when processing endoscopes? A. Using a container with a lid. B. Thoroughly rinsing instruments before immersion. C. Organic soil remaining on the device. D. Testing solution concentration before each use. 20. What is the main purpose of decontamination in medical device reprocessing? A. To ensure items are completely sterile before packaging. B. To remove bioburden and make devices safe for handling. C. To lubricate moving parts on instruments. D. To check packaging integrity. 21. Which area of the medical device reprocessing department must maintain positive air pressure relative to adjacent spaces? A. Decontamination area. B. Clean assembly and packaging area. C. Sterilizer loading area. D. Utility room. 22. When should an instrument tracking system be updated during the reprocessing cycle? A. Only after sterilization is complete. B. At each critical step, from cleaning through storage. C. When items are issued to the end user. D. Just before instruments are disposed of. 23. Which water quality is required for the final rinse of instruments before sterilization? A. Tap water. B. Hard water. C. Treated or deionized water. D. Saline solution. 24. According to MDRAO, what is the maximum recommended storage time for sterile items in event-related shelf life practice? A. 30 days. B. 60 days. C. Depends on package integrity. D. 1 year regardless of condition. 25. What is the main purpose of a load control label on sterilized packs? A. To display the chemical indicator color change. B. To track the sterilizer cycle and date for recall if needed. C. To indicate the instrument's Spalding classification. D. To verify the packaging material type. 26. Which of the following should be done immediately after manually cleaning surgical instruments? A. Place them directly into storage bins. B. Air dry them thoroughly or use lint-free towels. C. Spray them with oil-based lubricant. D. Submerge them in disinfectant overnight. 27. Why is it important to keep hinged instruments in an open position during sterilization? A. To prevent cracking of the hinge coating. B. To allow steam or gas to contact all surfaces. C. To minimize instrument weight inside the tray. D. To reduce drying time. 28. Which of the following is the best way to verify that a steam sterilizer cycle was successful? A. Observe that the chemical indicator changed color. B. Check that the load feels hot after the cycle. C. Confirm mechanical readings and biological indicator results. D. Make sure the packs are dry and intact. 29. What is the purpose of using a process challenge device, PCD, in sterilization monitoring? A. To ensure proper packaging configuration. To simulate the most difficult items to sterilize in the load. C. To verify storage conditions over time. D. To measure ambient room humidity. 30. What is the best practice if a chemical indicator inside a sterile package shows an incomplete color change? A. Discard the indicator, but use the instrument. B. Consider the package non-sterile and reprocess it. C. Mark the package for immediate use. D. Ignore the indicator if the outside label changed. 31. According to MDRAO, which document must be maintained for every sterilization cycle? A. Manufacturer warranty. B. Cleaning agent purchase receipt. C. Load record with cycle parameters and operator initials. D. Patient consent form.